Hello, and thank you to all for joining. I am Heather Palmer, the moderator for the Seniors Panel, and I am tuning in from beautiful Barrie, Ontario, and therefore would very much like to acknowledge the traditional territory of the Anishinaabe people, which include the Ottawa, Ojibwe, and Potawatomi nations, which are collectively known as the Three Fires Confederacy. I believe I was asked to moderate this panel not because of my age, rather because of my deep and long, as in 50 plus year, passion for improving the quality of life for seniors. Perhaps the ask came about as a result of my immense appreciation for the Genwell Project and all of its good work, but even perhaps it was my more immense respect and adoration for its founder, Pete Bambachi. Whatever the reason, here you have me. And while I recognize that historically the majority of work in the areas of loneliness and social isolation has focused on seniors, it still isn't enough. However, I was thrilled to learn from Kiffer's talk this morning that while seniors have traditionally been identified as a more lonely population, the current data from the Canadian Social Connection Survey has revealed that respondent group results are identifying them as less lonely than some of the other age groups. And I find this exciting for two reasons. Firstly, perhaps through the baby steps of multidisciplinary effort, great progress is being made. And secondly, perhaps there are learnings from the work being done in this age group that can help in a broader sense to all age groups. We have 4 panelists who have prepared wonderful presentations that we will watch together for the next 24 or so minutes, following which they will all be live to engage in what I hope to be a great Q&A discussion. We hope that you will engage with the content and each other as the presentations play by adding comments and questions in the chat function to your right. Alrighty, let's get rolling.
But since I don't know exactly who all is listening, Hello, thank you to the Canadian Human Connection Conference for allowing me to share about my research. I know that some folks listening may already know a lot about social connections. But since I don't know exactly who all is listening, I'm going to start from the beginning of the story of this research. So here we go. How are you? I found that asking that question since the pandemic started can be quite loaded. We've all had our day-to-day lives completely disrupted. And maybe you, like me, still have family and friends that you haven't seen, and you miss them. Loneliness in cities was on the rise prior to the pandemic, and a major concern is that physical distancing has intensified loneliness further. Older people in particular face health, mobility, and technology challenges that make it difficult to stay connected while following public health guidelines. Even prior to the pandemic, 1 in 4 older adults experience loneliness. And simply stated, loneliness is bad for our health. But I'm not here just to tell you doom and gloom research stats. My doctoral research explores the loneliness and social connectedness experiences of older adults. Social connectedness protects against loneliness and makes us healthier, happier, and live longer. I focus on social connectedness to give people the opportunity to also talk about the positive things that can happen during challenging times. And I was totally blown away with research participants' stories of strength and resilience during the pandemic. But before I share more on that, let me take a step back and tell you how my doctoral research project came about. Back in March 2020, right after BC declared a state of emergency, I connected with staff at the West End Seniors Network. Weston and I had worked together on various community-based research projects over the last 7 years. Pictured here is Barclay Manor, the home of the organization in the heart of the West End, on the unceded and traditional territory of the Squamish, Musqueam, and Tsleil-Waututh peoples. The West End is unique as despite its picturesque backdrop, the people who live there have lower incomes than the Vancouver average and are more likely to rent. Also, the proportion of older adults who live alone is twice as high as the city average. In that first meeting with Wesson, we recognized that we knew little what was happening in the day-to-day lives of older people who live outside of long-term care. So we took a deep breath to ground ourselves and crafted my doctoral research project. I set out to listen and learn from older adults directly. To do just that, during the initial strict lockdown in May 2020, I interviewed 31 older adults and 9 of them took photographs to provide a deeper window into their lives. I will share some of their photos in the next few slides. 90% of the people I talked to lived in small apartments, and the large majority of them lived alone, which offers a particular perspective of pandemic living. Their experiences taken together show how 3 aspects of their neighborhood environment matter for social connectedness and well-being. The first aspect was the giving and receiving of support among neighbors. Josephine said, "I realize how much I have built a community in my building. I had people I could rely on, and I knew if I needed anything that they were just a phone call away." People repurposed hallways and rooftops to meet at a safe distance. The second neighborhood factor is access to green spaces. Marilyn explained, "This was my first walk out after we were locked down, early morning and not too many people. This wonderful scene set the stage for me to relax and feel I would be okay. The natural world will sustain my spirit." With the shutdown of organized indoor activities, many participants explained that outdoor walking alone or with a few trusted neighbors increased in importance. They chose walking routes and times of day to avoid people and be close to nature. The third aspect of neighborhood environment was volunteer-based organizations. Although the physical buildings had closed, some participants received wellness check-ins via telephone, and on the flip side, others served as peer outreach workers and had weekly conversations with our eldest elders in long-term care. Participants also experienced challenges. Nancy's photo, titled "Yearning to Escape," speaks volumes. She lives in co-op housing and felt constrained by the dark and dampness of her unit. She raised important questions about what's the difference between a house and a place that feels like home. Larry created this image and said, "You get overloaded with news that inevitably shows a death total. As a senior, there is almost an unearthly feeling to this time period we are going through, sort of a bizarre copy of a medieval time during the Black Death or some other era." Despite the negatives, my research challenges the mainstream media idea of older adults as simply sad and vulnerable. Yes, participants felt isolated, but they showed tremendous agency to adapt their daily lives and connect with others. Many acknowledged they were doing okay because they had stable housing and economic security. Where do we go from here? My doctoral research is a work in progress. I just collected 2-year follow-up data that I'm in the early stages of analyzing. Here is the response from one research participant when I asked how the pandemic has impacted her ability to get out and about in her neighborhood and her social connections now, 2.5 years on from the start of the pandemic. She said, "Oh, it's changed tremendously, and I can see it in my physical health, that I don't have the stamina that I had when I was walking 5 miles a day. I don't want to be around people who are not wearing masks. And so for me, it's been a trade-off that I want to stay alive. There still are so many more books that I want to read and things I want to see, so I've had to compromise." Also, we know so many solutions to tricky problems like social isolation and how to encourage social connections reside in community. So that's why I hosted an interactive photography exhibit that's actually still going on to ask questions and continue the dialogue around what programs, policies, and shift in perspective can support those people most at risk of social isolation. I will leave you with a small piece of what I've learned from my research. It's that if you feel like you are struggling to regain social connections, you're not alone. And also, pausing to say hi to that person in your neighborhood may make a small yet meaningful difference for both of you. Thank you so much for listening. Please feel free to reach out with any questions. And if you'd like to read more about this research, here is a recently published article, and I crafted it into a 4-page or layish language blog. So thank you again.
Hi. My name is Maxwell Hart. I'm an assistant professor in the Department of Geography and Planning at Queen's University, where I'm also the director of the Population and Place Research Lab. I'm absolutely thrilled to be with you virtually today to talk a little bit about human connection. As a planner, that's what we aspire for. We're hoping to connect people. Today, I'm going to talk to you about an ongoing project I lead called Aging Playfully, where we try to rethink the world around us in terms of playful design, specifically for older adults. So I'm going to share a couple of slides with you today that give a brief idea of the conceptual part of our project and a little sneak peek at some of our results. So when I think about human connection, I also think about its antithesis, loneliness. So loneliness is considered more harmful to human health than smoking 15 cigarettes a day. Older adults are especially susceptible to loneliness, as they are more likely than any other group to live alone, be widowed, not participate in the workforce, and have smaller social networks. Unfortunately, Canada may be facing an enormous surge in loneliness. We can think about the COVID pandemic as really showing us what being alone can feel like for a lot of people. When we think about Canada more broadly, the risk that we really have moving forward is we have one of the largest baby boom populations in the entire world that is rapidly moving into retirement in a different phase of life. But we also have a lot of built environments that look like this. We have very, very suburban built environments. Some would argue the most in the entire world. So this combination of a rapidly aging population and an overwhelmingly detached car-dependent built environment is problematic. Without timely and targeted intervention, older adult loneliness will increase. And with increased loneliness comes depression, poor cardiovascular health, reduced cognitive function, and even premature mortality. One way to support older adults and create truly age-friendly society is through one of human nature's most simplest and most universal behaviors. That is play. It could be a sport, it could be jumping in a puddle. But play is almost exclusively considered to be an activity for children. But why? Play improves physical and mental health, it strengthens social connection, it increases a sense of belonging. It has the potential to address many of the physical and mental challenges that actually come with aging, while simultaneously countering social isolation and loneliness. So the Aging Playfully project is the first project to extensively examine older adult play and the built environment. So the goal of this project is to examine how play can be integrated into urban planning and design to support not only older adult well-being, but also societal, social health, and cohesion. So in this presentation, I'm going to talk to you about this conceptual framework that we've developed and a little bit of a sneak peek into how play might give us an opportunity to improve the lives of our people in our communities. So at the heart of this project is the belief that social and built environments should be developed to optimize opportunities for well-being and to include proactively positive measures. Enabling environments can do more than minimize risk. They can encourage fun, they can generate play, they can connect humans. So let's get started quickly. Thinking about this as a concept. So every person exists within a social and physical environment, but they also possess their own characteristics that's shown here in this bubble. So the physical environment is the built environment that is around us that we can touch and we can feel. And the social environment encapsulates social networks, friends and family, civic engagement, employment, support services. And more broadly, it can include attitudes, beliefs, messages, and culture. And then those individual the individual characteristics encapsulate any feature belonging to a particular person. So for example, their height, their personality, or their hobbies. So all of these things interact with one another that leads to either positive or negative outcomes. If they interact in a positive way, in a negative way, this can be a limited environment. So for example, if you're an older adult and you don't have a vehicle, which might be an individual characteristic, but you live in a car-dependent neighborhood, a physical environment. Therefore, you don't know very many people in your area. You aren't really able to get out as much and interact. That would be your social environment. But of course, they can come together in positive ways as well. So if you're an older adult with a pet dog, an individual characteristic, and you live near a dog park, which would be a physical characteristic, a physical environment, then you're able to interact and socialize with other dog owners and gain a sense of community and connect with people in a social environment. So it's really important to acknowledge that these environments exist as a spectrum. There's no perfectly limiting or perfectly enabling environment. But one of the things we want to do is to be able to guide people towards the enabling side of the conceptual framework. So if we think of this as a whole, every single person's individual characteristics, the built environment around them, and their social environment they engage in, they interact with one another. And we really want to push it towards that enabling side of the environment. So the thing that we're arguing is that play can do this nudging. Play can help us move that way and think about and interact with our environments, both social and physical, in ways that can make us healthier and happier, as well as our communities. So one part of this project was looking at Victoria, BC. So this is the demographically oldest community in Canada. And so what we did, it was a lot of fun. We did this past summer. So we had 14 participants, older adults, and we asked them to do a photo voice. And what a photo voice is we asked them to go around and capture photos of their environment that either, one, enable them to play, or two, limit their ability to play. And we had great conversations around what it means to play and how diverse that can be. After they took their photos, we printed them out and we sat with them in a public place, and we had a nice focus group to chat with them about their experiences and about their photos. So I'm going to give you a few sneak peeks into what we found and what we heard from our collaborators. So this shot here, I thought was really interesting because there's a lot of different things happening. And the quote on the side from the participants says, okay, you know, there's a kind of joy that comes with this. I know I feel relaxed looking at it. I'm from the East Coast originally, so seeing the water is always nice for me to see. And she talked about the opportunity that it's there. And so, okay, there's all kinds of different things you can engage with. You could throw stones, you could wade in the water, you could do all kinds of things. And so the fact that you could pick your own setting speaks to the diversity of experiences when you think about play. This one, I always love these in parks or ping pong tables. So this person really loved about the idea that you could be pretty spontaneous. You could walk by and say to a friend, hey, let's go play. It's beautiful. And maybe let's grab a coffee. So you could even do it with stones. You could just make your own game up. So building this infrastructure allows people to be spontaneous. And this last shot was really part of a wider discussion around inclusivity and intergenerational exchange. And so it's saying about older people don't always want to just be around older people or on their own. The idea of being with children or with different people of different ages can really promote play in a big way. So we found that enabling environments are natural, flexible, inclusive, and accessible, and also nostalgic, and limiting ones were more dangerous and stressful. So what we want to end on is say that there's more to inclusive design than caution and access. Rather, the built environment should be designed to optimize opportunities for older adults' well-being and not only minimize their risk.
Good afternoon, everyone. My name is Namrata Bagario. I'm a PhD candidate at University of Ottawa. And today I'm going to present to you my research, which is on recreation prescription for social isolation in older adults. So before we begin, let's have the overview of a few terms. So what is loneliness? Loneliness is the perception of social isolation or the subjective feeling. And what is social isolation is the objective lack or limited contact. Recreation is activity done for the enjoyment when one is not working. A decision support system is an information system that supports a business or organizational decision-making activities. And RxOSI, Rosie, that's the name of the tool that I'm building. So I have a short video, which kind of in a minute gives you a snapshot of what my thesis is about. Social isolation in the elderly population is a public health emergency today. Social isolation causes early mortality. Recreation activities not only have health benefits, but also improve social isolation and loneliness. Doctors today are prescribing recreation activities to tackle social isolation. My thesis focuses on developing a decision support tool to prescribe recreation activities. This tool, Rosie, will help practitioners prescribe recreation based on personality, health, social engagement, and accessibility needs. So instead of providing cookie-cutter solutions, practitioners can recommend activities based on personality and interests. And thereby, we can improve the quality of life even for those who are shut in. So I hope this has helped you quickly understand what the thesis is about. This diagram I have taken from the Alliance for Social Prescribing in Ontario, which shows you basically the key components of a social prescription: the client, the prescriber, the prescribing navigator, the prescription, and the data tracking. So taking this as the inspiration, how would you imagine this in a software system? Would be, let's say, a multi-intake system where the different stakeholders are physicians, social worker, caregivers, elderly, and senior staff, the electronic health record, the social worker intake form, user preferences, and resident intake. Like, these are the different ways you can get information. You can have one or more than one, but this is like a holistic approach. Then taking the health conditions, health events, social determinants, running the rules through a prescription database. That's the decision support. And the prescription would look something like this: whatever the intervention is needed, the frequency, the duration, and the notes. So this is a big picture imagination of the system. Now, the main research question is, how can we build a decision support tool to prescribe recreation activities? So I've just limited this research to recreation activities. So who are the stakeholders? What are the different recreation activities that are needed? And then what are the requirements for this decision support? And how can you validate this tool? So these are the main questions. And I'm using a design science research methodology since my main faculty is in engineering. So basically, you use iterative methods where you identify the problem, you define the requirements, and the requirements are defined through qualitative research. I have recorded a podcast called Seniors Junction Podcast, and I'll be doing a thematic analysis. And then those same requirements are then validated against a semi-structured interview with stakeholders. From that, the problem is reiterated. Then the prototype is developed. Then it's tested. Then it's iterated again. Then again it's tested, iterated again, and at the end of it, you have a thesis. This is an example of how do you create a domain model, like how do you knowledge translate from a domain to a software. So what is the recreational activity, the setting, the domain, collaboration type, what is the setting, where is it being implemented, how frequent, what is the purpose, what is the domain, and what are the social elements. So using this, then you can decide which software, what kind of things you need in your software, but this is like the complete overview of what all activity domain needs. And the gaps in the literature are, there's no clear decision methods, although there's there in the literature that, let's say, walking or nature and all this helpful, but it's not who should be given that or why should somebody be given that. There's no clear classification levels of social isolation, which means there are some tools available for sure, but they do not tell you the gradation level, like what level of social isolation. There's no clear dose-response relationship. There are no alternative activities suggested. And also there's no clear goal definition. So these are the important things when you make a software system for decision support. And so this is the schema of the podcast analysis, which basically you have the root codes. And this is based in the social exchange theory of aging. Although there are many theories of aging, I chose that which is the most relevant. So you can see what are the social support, social exchange elements. And based on that, I'm analyzing the podcast. And the requirements validation is through semi-structured interviews to see basically unseen issues. And then there are 32 questions. And of course, not everything that you collect can be used to build a system. And once I make the prototype? How do you validate that decision support? So that's another survey where you basically ask questions, you measure the level of satisfaction, and this survey will contain 26 questions. And thank you so much.
Hi, everyone. Thank you so much for having me today. I will be the last of your panelists, and my name is Ashley Sumler. I'm the Director of Quality of Life at Amica Senior Lifestyles, and I'm thrilled to be sharing my experience today with you and hopefully some practical strategies that you can take away to help support reducing isolation and creating belonging in senior congregate care settings. So we know that moving into a congregate living setting like a retirement home or a long-term care home doesn't immediately solve for potential social isolation. Proximity just doesn't mean connectedness. We see it in other aspects of living situations, like in condominiums and apartment buildings outside of the senior space as well. For many seniors who've lived in their home for many years, just generally the move to a congregate living setting can be very overwhelming. And as a result, we often see that as an additional barrier and an initial challenge to overcome when creating social connectedness. We have to make intentional decisions to embed practices and processes into our operations to really ensure that we're supporting quality of life, social connectedness, and a sense of belonging for our seniors. So there are really 4 key elements that have supported Amica in doing so. Number 1, we need to know who people are as humans, not just the tasks that need to be carried out to maintain a specific level of physical health. People are complex, and we need to get to know them very well. We need to be intentional about who we introduce, how we connect people together, and then follow up to see if we've hit the mark. If we haven't, adjust as necessary and take a different approach to see if we can improve. Measuring, often difficult to measure actions and outcomes, ensures that these priorities are top of mind for all levels of our business. And creating opportunities for residents to lead the way, guide decision-making, and come together for different causes and opportunities can help build engagement and connection more quickly. So I'd like you to meet Joan and Daisy. Daisy is the dog of Joan, one of our residents. And in getting to know her through her initial inquiry with our team, we learned a lot about Joan, but what really stood out for us was her worry that Daisy wouldn't be accepted into the community. She was in fact more worried about Daisy's connectedness than her own. And so our team set out to find a way to help Joan feel connected by keeping Daisy connected as soon as she moved in. They shared kibble amongst all of the team members and a few choice residents that we thought would be good matches for Joan. And then as she moved around the community that very first day, Daisy was met with a little treat everywhere she went, and it really opened the door for Joan then to talk about Daisy and how important she was, but also then removed a barrier and started a conversation with residents and team members so that they could also get to know Joan better. And so what we learned from this is we can't just have a checklist. It's not just about taking a social history or understanding the care needs of our residents. We have to get to know them deeply. Who are they as a person? What's important to them? How they like to contribute? Not only what their interests and preferences are, but also what are the things they still would like to share? What's really important to them and has impacted their lives? We coach our teams to take a semi-structured interview type approach where we know some of the key themes that we're interested in gathering information, but it also leaves a lot of space for the resident to take the conversation wherever they're interested, and in turn lets us know what's really truly important to them. Once we have this information, it doesn't just go into a drawer to sit. We share it in an electronic records keeping system, and it's our entire team's responsibility to know and use this information as they get to know Joan and Daisy through their time at our building. The best part is that it means that this resident doesn't have to introduce herself and reshare information over and over. By sharing it with our team proactively, they can be more responsive to her needs and help engage her in a more meaningful conversation about Daisy or about other interests she has, versus just asking about the weather. So once we get to know people really well, in some cases also including their family and getting to know them and what interests them and what they're bringing to the table for life experiences and interests, we start pairing people together. And like I said, we document this so we can follow up to see if we've made meaningful matches and understand trends and themes of different types of people who maybe match well together. Sometimes this is interest-based, sometimes it's values-based. Really understanding what a person is looking for in a friendship could just be a social card playing, could be deep, meaningful, philosophical conversations. Once we get a better sense of what that resident is looking for, we can adjust and be more intentional about really building connections. In addition to pairing residents together, we also are really intentional about how we pair our team members to our residents, especially in those types of roles where our teams are supporting our resident in their suite. This helps create continuity and builds trust so that our residents feel like the team is all part of a larger community. We're creating a sense of belonging within the whole building, helping to increase inclusion and remove discrimination and barriers around residents living with dementia so that everyone feels a sense of belonging as part of the Amica community. Thirdly, we take a metrics verified approach. We know that what we measure and what we report out gets attention. And this is such important work. It's important we're able to share that broadly amongst all people in the organization, right from frontline team members all the way to the executive level. So the ongoing conversations we have are updated every 6 months. They don't just go into a drawer to sit on a piece of paper. It gets shared broadly with the team and gets layered into our wellness plans. So we know who are important to the residents that we serve and how they like to be connected to the people in our communities. We track the intentional pairings, and we also track feelings of belonging and the feeling of having a close friend that someone can talk to in our residences through our resident satisfaction survey cycle every year. And most current, and we're just finalizing, being able to have a quality of life score attached to each resident based on a variety of validated questions in a quality of life tool. So our team can better understand if it's social connectedness or isolation or feelings of belonging that are driving a particular score, or if they can understand if there's pain or sleep challenges or other types of inputs that might be affecting their quality of life. This helps our team create action. We set company-wide goals for all of these measures, and like I said, provide visibility to know, are we moving in the right direction? And the last way that we really support creating connections is to give our residents the opportunity for citizenship, to speak up, tell us what they want to be involved in. Thinking about connecting to our community outside of our four walls, how can we give our residents more autonomy and choice to help create an environment outside of our buildings where they feel connected more broadly to their community? Having residents rally around a common cause is one of the fastest ways to build those types of social connections. As I mentioned before, having connections based on deep-seated values and experiences is one of the most meaningful ways to help people connect together. I hope that chatting through some of what we do at Amica has helped you maybe think a little differently about how you're supporting social connectedness and reducing isolation in your residences or your other congregate living settings. It's been a pleasure. I look forward to the Q&A. Thanks, everyone.
Hello, welcome back. Thank you very much to the panelists for their fantastic presentations. I'm going to ask them to join us now. I'll introduce Callista A Ottoni for first, researcher at the Active Aging Research Team, UBC, and also a PhD candidate who is doing great work with her PhD dissertation, as we learned. We have Max Hart, who is the assistant professor at Queen's University and the director of the Population and Place Research Lab. Welcome, Max. Namrata Bagario, who is a PhD candidate and also the co-founder and CEO of Seniors Junction. And then finally, our last speaker, Ashley Sumler, who is the Director of Quality of Life, Amicus Senior Lifestyles. Thank you and welcome to the panel. We have around 20 minutes to have some great, hopefully, discussion and engagement. I did notice some fantastic comments coming through. So I thought I would just start kicking it off with some of what we're seeing there, and we'll see where that takes us. So the first thing I'll do is I'll post something towards Max, because I'm interested in Jamie Bauer's comment, that some of your work reminds him of the YMCA incentive or their initial plans. The focus was around the concept of sport. So how do you see the concept of play being integrated, or what can we learn by the successes of the YMCA and maybe even seek out collaboration and partnerships with them?
Yeah, thank you, Jamie, for that comment. Sparks started flying immediately thinking about the history of the YMCA. I hadn't really thought of that parallel, but I think the big thing that strikes me right away is the context of why it was developed, the rationale in the first place. So the YMCA coming out of Industrial Revolution era London, when there wasn't a lot of activities that were considered to be healthy activities for young men at the time. So leaning towards sport as an opportunity to help make human connection and happy, cohesive places. And when I look around our cities now, I see a similarly narrow offering to some extent. So when we think about public space and planning, that's my background. When we think about children, there's playgrounds. Teenagers might have a skate park, or if they're lucky, a basketball court, depending on the type of neighborhood they're in. And then when you get to adults, it's very consumption based. It's hard to do a lot without buying a coffee or doing something else. And then older adults, it can be even more narrow in terms of you're making a public space, you make sure there's a bench. So I just think that the rationale and the context is really a striking parallel, and that we can learn from it to be proactive about it and encourage that in terms of the spaces that we create. So thank you for that comment. It's really fascinating. It's going to be, I'll think of more, I'm sure, but it was great. Just right away, lightning started going. So thank you very much.
So Max, you'll have an opportunity to pipe in again, because I want to build on your comments on that and Jamie's comment, and ask you, Callie, from your research and the directions that you're going, what do you think some priority actions are or policies that need to be put in place around social connection, isolation for seniors? And do you see that integrating well in terms of some of Max's urban planning ideas?
Thanks for that question, Heather. Yeah, and thanks to all the other presenters. It's great learning about your work as well. Yeah, so I feel like researchers love to say policy implications, but it's often really unclear what that means. And so I like to think about it in terms of the levels where social connections happen and the necessary policy at each of those levels. So on a national level, Canada's really done nothing. And I think that we see growing momentum around, recognize. So what a national policy will do, it will provide more momentum to elevate the importance of social connectedness for our health and longevity. Because as we can see from the presentations this morning in this session, it's such clear connections between health and well-being and longevity. So national level policy, and a provincial level policy is, we know as Max said, that connectivity just doesn't happen. Or wait, actually, I don't know if it was Matt. One of the presenters was that it doesn't. I think it was actually Namrata, that just because we're close together doesn't mean we're connected. So in terms of how we build our housing, so housing policy that encourages social connections on a provincial level. And on a municipal level, I completely agree that we need just for informal social connections to happen, such as play, because the research also shows that casual social interactions, like those incidental, going to the grocery store, sitting outside, talking to people at the park, can have such a significant impact, and sometimes be the only social connections that someone might have in their day.
Mm-hmm. Thank you. Thanks, Callie. And feel free, if another panelist has a question for another panelist, feel free to pop in. I do have a follow-up to that, which is, when I hear policies, national, provincial, municipal policies, I try and think of the big bubble of, everything that needs to be included in that. So some of it is around how we actually build. A big part of it might be around creating awareness. Most people don't understand fully the importance of human connection to our mental and our physical health. Namrata, another piece was like, how are we then going to, so what are we going to prescribe as being the appropriate, using those environments, let's assume that we've built them, what is the best prescription for somebody? And in order to come up with prescriptions, we need to be able to assess. And it sounds to me like your Rosie tool is about creating an environment where people can assess how someone's doing and then make some sort of social prescription. Is that correct?
Yes, that's correct. I think if you, sorry, go ahead.
I was just going to say, so do you see this as playing a role, in a broader context and being incorporated in some sort of policies or recommendations?
Yeah, I mean, policies are, I would say, the last milestone when you look at software, because if you have the users with you, it's not that difficult to convince policymakers. So when you think of a life cycle of a software, it is shorter. It has to be faster if you need to have more people onboarded, and it's contextual. For example, people living in their communities are very different from people living in senior living community, because there a lot of your social determinants are common, right? What food are they eating, what kind of home are they living in, if they're in a senior living community. But just by living together doesn't mean they talk to each other. There has to be a programming done, because if that was the case, then we wouldn't have that problem. So I think the first thing in terms of a software is showing evidently through data that these are the 4 or 5 main contexts. Let's say a housing, and let's say maybe people factors, or whatever the things come out of the data from the research, and then tying up with not just academics but actual brokers of policy changes, like advocacy organizations or people themselves, because there's no bigger power than people. If people are on your team, you can convince businesses, you can convince policymakers. So I like to focus on people, because in the first 10 years of my career, I've done enough not for profit work to know policy thing is a elephant in the room. It might move maybe just in my own life or someone else's lifetime. So I'm not focusing there. But if someone wants to work with me, they can come, because the context is going to change, right? What other softwares, let's say Amica has a different system, which may not be the same as, let's say, another senior living. So it has to be interoperable. And the policy will just say, make systems which are interoperable, make systems which are payment friendly, but you have to do the work. So,
And Namrata, does your system, or currently, or is the plan for Rosie moving forward? And I'm just thinking from perhaps Ashley's perspective in seniors living, how is performance then measured? So we're able to assess and prescribe through Rosie, from what I understood from your presentation. But what's the loop back to say progress has been made? We're moving the dial for these individuals, this group of people, etc.
so if you understand social isolation, it's not a permanent state, right? It's a cyclical process. Different people are maybe lonely for a different period of time. So it has to be a constant use and a constant evaluation and feedback. Otherwise, the system doesn't make sense. So my hope is, first is finishing the thesis. So whatever is the thesis finishing benchmark, where we have those surveys, which are, I think, a few weeks apart from each other. And in that time, you'll see how people have used. And from that survey, you will get the feedback. Oh, this is good for twice a week, like twice a month, like once in 2 weeks. Because at the moment, social health is not at the place where physical health is. Because in physical health, the research started after World War II, right? 50 years of research is available. This is just beginning. It's just beginning, maybe a few years. So I don't have the standard amounts of knowledge about, okay, how much should someone do for how long, should do how often. For example, we know PHQ-9, how often you should ask them questions about your primary health, but we don't have that question, how often should someone ask about loneliness and social isolation. And also, if you actually work with seniors, it's very off-putting to them if you ask them a question about loneliness or social isolation. So Ashley is laughing because I've done enough work with them. So you have to ask them in another way. Like if you go with loss of meaning, what do you want to do with your time? And then slowly. So I think, yes, there is the need for cycle, but I don't know what that cycle is. So hopefully the research can shed some light into what that cycle will be like.
And thank you. That actually makes me think, Ashley, just turning to you and also making sure that we provide opportunity for comment and suggestions to Richard, who has self-identified as someone who's living in a private seniors residence. And it sounds as though he's quite meaningfully engaged, both within that residence, but also through his former coworkers, etc. But his wife is much less so. So I was wondering if you had any suggestions for him in terms of what he should be looking for, how he could collaborate with the residents to help engage his wife a little bit more. And then what role some sort of tool like Namrata's might be able to play, even if it's not available currently, what Amica might be doing in a more analog type way to address this.
Yeah, for sure. Thank you. And thank you, Richard, for being vulnerable and sharing your story in the chat. It certainly makes it easier for us as panelists to have real life situations to be reacting to. So thank you. From my experience, what we've seen is sometimes we rely so heavily on the interest-based connections that it can be, to your point, I saw in your comment, I have a lot of acquaintances here. And it's, people I bump into in the hallway, and it's not these deep, meaningful connections. So a couple of suggestions, just again, not knowing your wife, but just from what you've shared. There may be an opportunity to better partner with the staff and the team there. Think about the people who she's seeing anyway, right? When you think about, she likes to stay to herself, who are the people she's interacting with on a day-to-day basis, whether it's a housekeeper, whether it's a server in the dining room, whether it's a concierge team member or a nurse. Do those people know what's really important to her? And how can we share her life experience with them so that they can have more meaningful conversations? So if they're dusting, they can ask about art or, again, things that are important to her that require almost no effort on her part, really, where you're encouraging the team to lean in actions they're already taking. Secondly, again, in that partnering with the team is just being transparent with the team about wanting to potentially find people with similar interests or similar values. Even something like taking your Zoom church sessions into a common space, like in the theater, where, it might just be you two watching, but hey, someone might walk by and then decide they want to join you and might create an opportunity there. And so then thirdly, I would say, just trying to talk about, what are your wife's goals? What is she looking to achieve, right? We know there's people who never attend a recreation program the entire time that they live with us, and that's okay. But so if she's not attending the recreation programs, then what are those other outlets that exist? Again, whether it's connecting more with the team or connecting in more of those common spaces, doing things you would be doing just in your suite anyway. Might be a few places to start to just see if there's sort of a natural way to create more opportunity for those sort of random connections that may then lead into something more meaningful. But it's never a one size fits all approach. And I think that's what makes it challenging for organizations to find a way to formalize this type of work. But to what Namrata is working on, having something that gives us a more objective way to share these types of recommendations. And certainly with this age group, having, a healthcare provider providing those types of recommendations can often go a long way as well. I think absolutely, I laughed when Namrata said that people don't like talking about their quality of life, because it's true, right? We can't just tick off this box or on this list of things. We have to really think about, what's meaningful to me, and how do I ask questions meaningful to that person to really get a true gauge of if we're making the mark. And so that's where we've started heading is, really trying to document these validated quality of life measures for people. So while we know each person individually, might weight those items differently, and we'd love to get to a point where we can do that, starting with just understanding, like for a person, what might be contributing so that we can be more strategic, have better, prescription, and make it as important as other aspects of health that we, already have legislation around. Like, we have to assess for health outcomes every 6 months. Why not social and emotional outcomes too? So.
Thank you. And, it's one thing that you said, Ashley, that has been mentioned before, and it was even mentioned in earlier presentations this morning, is the concept of it's not one size fits all, right?
Yeah.
And that's really a huge challenge.
Mm-hmm.
I think in, the direct interaction with individuals, it's a little bit easier to be more flexible and better understand what an individual's needs are and how to do that. But I would imagine, Max, from an urban planning perspective, that must be the challenge for you. Like, where, other than observing seniors and talking to seniors, where are you getting your ideas from? And is there opportunity to work with large senior living operators because they have the data of where their residents are going, what they're wanting, and if that can help to inform some of the urban planning that's also available at a public level, both indoor and outdoor?
Yeah, absolutely. I mean, yes, plays a universal, but at the same time is deeply personal. So whether it's playing dominoes or pickleball or having a snowball fight, urban planning is critical to enabling and shaping those places, and doing so, hopefully, facilitating human connection. And I do think there's a link there. It's funny. I was talking yesterday about a new master's student who's developing her project, and we were kind of, one of the ideas that she was thinking about is going and talking to recreation facilitators and program facilitators in an older adults living environment, and seeing how those could be translated to the public sphere, and to see what could be learned, because there's a wealth of information and knowledge and expertise there. And then the tricky thing is always, you're trying to create space for everyone, literally. And so that's the challenge of urban planning. And I think for a starting point, just starting with good planning principles, that for me are really crucial. I mean, one is, like you've already mentioned, Heather, you talk to the people who live there and talk to the people, see what they want. And then go slow, don't overdo it. I think it's a big thing. Over programming, over planning for public space is sometimes hard to undo. And there's a very limited amount of money for physical infrastructure in cities. And so when something is done, as we can see from all the sprawling suburbs around us, it's pretty hard to undo. So doing less is a great idea, I think. So, it might be a splash pad, might be appropriate for a particular community. But to me, it's conversations around, I think, social construction of play and age is the thing that we can learn a lot from. I always talk about, someone's who might be very kind of quiet and stoic the rest of their life. If there's a child around, all of a sudden they're happy to be a horse. And so how do we find that, and why is that the case? And maybe not that example exactly, but how can we make our places have people feel comfortable and feel free to engage? And I do think the environment makes a big part of that. But yeah, I think there's a wealth of information to be had from people who have expertise around programming and around those kind of social interactions.
And we've got a few minutes left, so I'm going to ask one more question and then open it up to the panel to ask each other questions if you wanted to. I was hoping you would just jump in, but so Callie, I'm intrigued because you, same as Namrata, you're a PhD candidate, so you're partway through your research, and I'm just curious, what has any of the talks or the discussion that's happened so far with this conference, or even within this panel, is it shaping or getting the wheels going in terms of what some of the next steps might be in terms of your own research? So what are those next steps and priorities that you're focusing on, Callie?
Yeah, great question. So I guess I think like it's actually really heartening to hear learn about these different tools and strategies that from the other presenters, because I had no idea around just like that level of, you almost want like people in general society to have like the matchmakers of social connections. I was like, I want to live there one day. That's great. But just like to hit home, I think the thing is that, social isolation and connectedness is it's such a tricky problem. And so we really need this kind of all forces at all different levels approach. And so it's great that things like this conference, again, are bringing people together to have these conversations. I've collected most of my data and started the early analysis, and and it's actually the 2022 data is quite a bit darker than the 2020. I will say that there was such an outpouring at the beginning of this neighborliness. Like that was one of my main findings, but so much of that because I work specifically with the older adults that live out in community and they don't want to move. They want to live there as long as possible. So a lot of my work is around how can we create environments to support them to live there. And so these neighbors that they had connections with, they've gone back to work, they've moved on with their lives, but these people are still living alone, still more scared to go out. So I would say that, just that there is an urgency. And although that, there are some favorable indicators and older adults are, performing well, it's those most vulnerable older adults that have precarious income, housing, and multiple physical challenges that are the most vulnerable. So I would just urge people to think about those folks when we think about solutions.
Wonderful. Are there any questions that you have for each other, or last comments that anyone wanted to share?
So I just wanted to answer to Jamie's question about what type of social prescribing. So I'm using both gray literature, which is practice-based literature, because understand social prescribing at the moment is a practice-based thing and it's a theoretical. So in academia, it's only now that some of us are working to give a couple of theory frameworks to it. So what I found out is physical activity is the number one method to socially connect. So walking groups, for example. Second is music. So these are the two most common. And third, fourth, fifth, the answers depends on what context you pick up. The answer can change from games. It can go to social activities like bingo or bridge or things like that. But the first two are clearly music, physical activity and music. And I think there was a comment which Richard. I just wanted to combine that with Ashley's thing. So in my research, what I'm doing is literally you have these 4 levels of classification, which is completely disengaged to highly active and the in between categories, somewhat engaged or irregularly engaged. And it's basically I have classified based on how many meals do you eat alone and how many times do you attend activities. Just these two things in the context of senior living, because it's very easy to measure and classify. Because sometimes you might say, oh, this person is a shut-in, and I've had that in our pilots. And those people were not shut in. They just didn't like the activities that were offered because it didn't match their interests. So I think, Richard, you might want to ask your wife or you might know what she liked before. Sometimes it's restarting something you left behind. Like my business partner, he started tennis. He was 18 years old, but he wanted to become a pianist. He's a retired piano professor. Playing tennis meant his fingers would at times be injured, so he stopped playing tennis. Now that he's retired from music, he's back playing tennis, and he won the most improved player award at 67. So he was super stoked, right? So I think one has to be agile and flexible. And like for me, today's conference, if you asked Heather, you asked, I am taking the research and I'm quoting some of them, and I have a submission in 10 days. I'm adding some of the papers now. So if any of you see your names cited by me, especially the social survey from SFU University, I think that because for me as a tech researcher, we don't create original health and social science knowledge. Please understand. So if that information is not available, I can't create a software. And so for us, it's more about efficiency and not original research of social isolation. But we can then show you patterns and efficiency so well, like what people like Ashley can benefit more from our work. So, thank you.
Thank you. I will take this moment to thank the panel. I think it's been a fantastic combination. For me, the takeaways is that there's lots of great work being done from a urban planning perspective, thinking through policies and how can we be advocates and influencers, what tools are we designing, and how are we actually influencing and shaping the lives of the people that might live within our residences. But there's still clearly so much more work to be done. And the exciting part is that perhaps the seniors population were a little bit further ahead because it's been a higher focus area for many years. And there might be lots of great learnings for the other populations, millennials and others as well, which is a wonderful thing to see it go the other direction than it normally does. For me, the biggest takeaway, as always, is we seem to be quite aware as a group, although we've all learned a lot today, but there's so many people who are not aware. So continuing to create awareness around the importance of all of this, and reaching out to those people who are not engaging and recognizing that as people go back to work and start to go back to what their new normal is, there's going to be many seniors who are left alone and feeling lonely. And so we can all do our own little part. Thank you, everybody. I appreciate your time, and hopefully you'll enjoy your 10-minute health break before the next session. Be sure to go to the session agenda to find out when to tune in, but that's approximately 10 minutes from now. We'll see you at the next session, hopefully. Thanks, everybody.
Thank you.